Let's face it, last year was the first year the average age of a woman giving birth was in her 40s.
Yes. Yeah.
Right? The majority of women were early 40s giving birth. So, that's a relatively 20 plus year gap of not knowing your body
Exactly.
before you go to have a baby. We focused on wanting to get pregnant. Then we just focused on being pregnant. Then we just focused on, okay, the birth. And then even after the birth, women are kind of like shoved back out into society, left alone with what little support system maybe they have in place to figure it all out. How can we later years in life want to have a baby, but we don't understand how our body works?
And if I could,
younger years?
if I had a nickel for every time I had a woman sit across from me, a brilliant, educated, capable, professional, respectable woman say, how do I not know this about my body? And the only answer is because no one taught you. You were only taught to contraception.
This isn't normal. Well, no, what we were doing for all those years actually wasn't normal.
Right, exactly.
It's just that's what you thought was your normal because you never learned what your normal was. So a lot of it too is backtracking as far back as they can remember, before they went on whatever they went on. And a lot of people really don't remember those first few years periods. I have a lot of women that don't even remember the exact age they were when they
If I ruled the world, which I do in my own mind, I would be asking that woman, if she thinks she wants to have children, to consider preparing to freeze her eggs so that she's just got some, and I don't like to use the word insurance policy because it really isn't that, but it increases her chance when life reveals itself to say, okay, now it's time. Should something be an impediment at that time, you've got a backup. You've got something to go to. She has a resistance to, and I share her resistance to the phrase, just deal with it in our phases of life, because we deserve to not just be told, go deal with it, but we deserve compassionate care and understanding and help in navigating through any of these transitions. And so she created Full Circle Premium Health so that women will have a compassionate and empowering place to heal.
The more honest they can be with themselves and with me, the better results we're going to have through all of this. And so if they could journal for 2 weeks or 4 weeks, and I want them to write down what they eat for their meals, what they eat for a snack, what time that was, what they did for exercise that day, and then bring in, most people use a good period app these days, I feel like. So I'm like, bring in, 6 months worth of your last cycle so we can go over that. Are they the same? Are they not?
If you're listening to this, share it with someone who's not yet trying to conceive so that they can begin to get their data earlier, like start at around age 28. And even if you're single and you have no desire to have a child, get an assessment of your reproductive wellness before you don't know what 2 years down the road is going to bring. Hey there, thanks for joining the conversation at Health University, where we're committed to making ourselves just a little bit smarter about our whole health and our reproductive health. Make sure to hit the subscribe button as well as the bell so you don't miss a future episode. Leave a comment below, especially if there's a topic you want to learn about. We're happy to know and to include that in our episodes. And since 1 in 5 people are determined to be struggling with fertility, share this with 5 people. You're bound to help at least one change the course of their fertility struggles and help realize their dream of family. We value your time and we keep these recordings as succinct as possible. But if you want to listen to the full episode, just click below and the entire episode is there at your disposal. Once again, thanks for joining us at Health University.